Welcome. We're going to be talking about environmental justice today because the environmental exposures that we have in our environment are not equitably distributed for all individuals. So we're going to be talking a little bit more about what environmental justice means and what are some examples. So we know that hazardous environmental exposures are not affecting everybody equally. And some of the factors that influence that are, your closeness to some of those sources of pollutants. And that could be, where you live, that could be where you work. And also, we could have different susceptibility to various diseases. So we can talk a little bit more about that. So this is related to developmental origins of health and disease and many other things as well. And also related to access. So not everybody has equal access to various therapies or treatments or protections. So we're going to be talking about all of that today. So just so we're all on the same page related to a definition for environmental justice. So this is from the Environmental Protection Agency, but environmental justice is the fair treatment and meaningful involvement of all people. So this is regardless of race, color, national origin, or income, with respect to development, implementation, enforcement of environmental laws, regulations, and policies. So that gives us the frame for what we're going to be talking about today. So some of the principles, so all individuals have the right to be protected from environmental exposures. And we talk a lot about adherence to the precautionary principle. So in the face of uncertain but suggestive evidence of adverse health effects, regulatory action should not prevent harm from environmental hazards. So what does that actually look like in practice? And we're going to be getting into that. So when we look in practice, there is evidence that there are disparities in where some of these hazardous waste sites are placed. So it's not just the hazardous waste sites, but it's also many industrial facilities, transportation thoroughfares where garbage is dumped, our CAFOs, and all sorts of other locally undesirable land uses. So those are LULUs for short. So when we're talking about this, what does that actually mean? So this is from the Frumkin book. And so what you see here, this is the distribution of major industrial facilities. So those are those dots. So this is where you see specific industrial facilities. Those are those black dots. And then as it goes in darker shades of green, these are the percent of people of color based on their census tract. And you can see that those dots tend to be placed in these census tracts of where there are more people of color. The other thing that you might see, this is, again, similar region, also from Frumkin. This is the same map, same dots of industrial facilities, but now placed based on the percent of people living below the poverty line. And again, you'll see with darker shades of green, those are individuals who have higher rates of poverty, so more individuals living below the poverty line. It's not just in California. So in Louisiana, there's this region called Cancer Alley. So we're not talking about this little bit. Like if you can see that this is hundreds of miles, and these are regions that have petrochemicals and industrial corridors and lots of different facilities there. And so they're examining these regions for increases to cancer risk. And so there are there's an article down here where you can look at the uneven magnitude of some of these disparities related to some of the toxic air components. If we look a little bit deeper, so this is again the Mississippi River as you kind of go down, and you can see this is income and industry in Cancer Alley in 2013. And so where you have these darker shades of blue, those are greater regions of affluence, the higher income. And the orange are these situated major industrial sites. And you can see they tend to be in regions where there is lower socioeconomics. So the question that many public health researchers have been asking is, so what came first? So are these populations moving into neighborhoods with higher environmental hazards? So maybe they have lower housing prices and that's why. So that's considered the minority move-in hypothesis. Or are these communities already present, and then hazardous facilities are sited in these communities? And it turns out there are two temporal studies that really hammer this. And both of them are showing that these LULUs tend to be situated in low-income areas. They tend to have members of community of color, and these individuals are not moving in preferentially. So this is a major problem. We've also seen it related to the Flint water crisis. So, for example, we know that we've seen, this is in previous weeks related to the water weeks, but as we have man-made natural disasters from, say, changing water pipes and not putting in the corrosion control, which leads to extra lead in the pipes, we're seeing that, there are certain communities that are going to be experiencing increased levels of lead. And what does that mean for their populations? So when we have these man-made disasters, for example, such as the lead pipes, for example, we can use this social vulnerability index to understand what communities may need additional support before, during, or after disasters. So it's wonderful in times of earthquake and in terms of tornadoes and other sorts of hurricanes, all sorts of different disasters. But it is also useful in instances like this. So we're looking at, Flint, Michigan, and here's a community that has increased social vulnerability compared to other regions. And so when you overlay these different and additional environmental exposures, it allows you to make increased predictions of what we might expect. The other thing that I want you to keep in mind, I've been saying this for a long time, I love this text box so much because children are not small adults, and this is something that we need to keep in mind. So as we're thinking about this related to lead pipes or some of these other exposures, children are very, very different. They eat more, they drink more, they breathe more, they touch their mouth all the time, they're all over the ground, they're all over the dirt. They have different metabolism. And plus, because they're so young, that means they have a lot of time for these exposures to build up. And this is a really sensitive period for their cognitive development. And finally, they can't change their exposures. So when I say can't change their exposures, they can't change their environment. So if exposures are in those environments, we need to be especially mindful for those children. And this is particularly true with Flint because, of course, lead can produce some serious cognitive impairments, potentially especially for children. The other thing that's coming down the pike is that we're seeing increased COVID mortality in areas with higher air pollution. And with more air pollution, we're seeing increased risk of mortality. So I love this map. This is something for us to think about. This just came out. And because as we're starting to talk about this, you can kind of see where this, so the top is particulate matter 2.5, the bottom is COVID deaths per million. And so take a peek at this bottom map and then kind of keep that in your head, because we can also overlay that map. So seeing that COVID mortality map compared to these maps, you might start to see a few things that probably look a little similar to you. So first, let me take you through what these different maps are. So the top left in red, this is your heart disease. So you'll have increased death rates from heart disease in this darker red. So you'll see a lot in the lower southeast portions of the United States. In purple is in the middle. This is the stroke death rates. On the right in blue is diabetes. The bottom left is obesity in 2009. And then the bottom right in red shows the areas of poverty in rural America. This is from 2008. But again, you'll see these darker red areas, again, tended to be in this lower southeast corner of the United States. So as we're kind of seeing all of these maps together, putting it with COVID mortality as well, there are some areas that tend to have increased risk of some of these diseases, some of these mortality, some of the prevalence in terms of diabetes here. So as we're starting to kind of put this together, think largely in terms of patterns. What are the patterns that we're seeing? So this slide is also from Kent Thornburg, and what he has been showing, and other scientists have been showing for a long time, is that there's this relationship to birth weight. And you're like, what? What are you talking about? How does that even work? And so what you'll see here is that these lower birth rate babies tend to have increased risk of chronic disease later in life. So the top left graph, this is showing you birth weight versus systolic blood pressure. So looking at hypertension or HTN, so the high blood pressure. The graph on the right is looking at birth weight versus the risk of developing coronary disease and stroke. And again, this is in a nurse's study, and again, you'll see this inverse relationship. So low birth weight is associated with increased risk of coronary disease and stroke. And then the bottom graph is looking at birth weight related to BMI adjusted glucose intolerance or diabetes, for example. And again, you'll see that same pattern. So there seems to be a relationship between low birth weight and chronic disease later in life. The thing that's starting to be a little bit concerning is that we're seeing birth weight in the United States is decreasing. And this is, if you look at all births, or if you kind of look at early births, or however that is working, they're all starting to trend to lower birth weight. And that may signal an increase in chronic diseases later in life. At least that would be the prediction. The other thing that we're going to be talking about a lot is this life expectancy and zip code. So you'll hear a lot about this, of how much does it actually matter? And where you live, turns out it matters a ton. This could be related to your proximity to various pollutants. This could be related to many other things as well. So let's kind of dive into this just a little bit. So if you want to go to Robert Wood Johnson Foundation, they have a beautiful interactive related to this where you can look at your own region. Let's just look at a few of them. So if we're looking at Cancer Alley, for example, this is Southern Louisiana versus Portland versus the Central Coast in California versus Northern Maine. So you can see that, generally we're in the 70s and 80s by and large. You'll see differences between men and women. There are sometimes going to be differential exposures there. So then if you look at this next slide, for example, and look at Williamson, West Virginia, for example. So this is a region that has high mining, and you have differences particularly between men and women. So I haven't gone into the demographics of the rates of mining between men and women, for example, but I would imagine that more men probably mine than women, and that might explain some of the decreased life expectancy for men in that region. So as we're starting to think through and look at some of these data, start to make some predictions about what you might expect and why you might be seeing some of these differences. So when we're starting to think about these things, it's not just these environmental exposures, but it also has these overlays of biological and physiological susceptibility. So that might be related to developmental origins of health and disease. That might be related to epigenetics. That may be related to, genetic predisposition. And we also have this social vulnerability. So in some regions, you are going to have increased vulnerability compared to others. So how are these going to amplify some of these inequities that we're going to be seeing? So as we start to think about these things, keep this graph in mind, or this figure in mind, because I very much appreciate it for thinking about health disparities and health inequities. They really matter. So in addition to that Venn diagram that you saw, there are also social inequalities related to power dynamics, related to financial inequities. And those decisions, who's making those decisions, may be those who are more wealthy. And so as we start thinking about this income inequality, how is that further exacerbating some of these environmental inequities and these health inequities? So keep those things in mind as we're kind of going through all of this. And finally, the climate gap. So we've been talking a lot about climate change. We know that we're going to see more and more climate change as we continue in years. And we're expecting that climate change will be disproportionately impacting vulnerable and socially marginalized populations. And so this is not only because, well, this is for many reasons, of course, but these individuals may have a limited ability to cope with some of these components. So we talked about social vulnerability. So how may they be able to recover when some of these things hit, for example? The other thing to keep in mind is that, we've been talking about developmental origins of disease earlier, and there's already studies showing that we're expecting to see problems related to pregnancies related to heat waves due to climate change. So for each 1 degree increase in temperature, we're seeing an increased risk in early birth and stillbirths. So, and in a prolonged heat wave, that early birth rate is rising by about 16%. So there are issues that we're going to be able to predict and hopefully mitigate because we're able to make these predictions. But will we be able to get there in time to help these individuals when they need it and before they need it? So as we're seeing more and more increases in climate change and predicted increases in temperatures, and we've talked about the heat island effect previously, but we're already seeing an environmental justice issue related to urban forestry. So despite all of these issues, in urban areas, there's less tree canopy. So that you would predict there's going to be increased rates of heat island effect, and you will have urban populations who are going to have increased impacts potentially from some of these heat waves. So as we're going through this, think about these different populations who might be impacted. And so I'm going to leave it at this. So we try to talk about things to impact and positive changes to make a difference and little steps where we can do it when we can. So if you're able to plant a tree, plant a tree. If you're able to think related to policy and to make some of these impacts, do that. Wherever you're able to impact change, please do that. We need all of you. We really, really do.